I think patients, one, either they don't realize what they're missing, right? So I was glad
Okay.
that this patient was curious
Hmm.
about, whether my recommendation and my diagnosis was actually accurate. And then she tried it and saw that she was probably missing more than she realized, right? So when you don't know what you're missing, um, they're like, I'm just fine. I'm functioning in my day-to-day life. They've accommodated, right? They've made accommodations for it in their life. That's one hesitation. They don't know what they're missing. Two is, the research shows there's a very significant what we call hearing aid effect or hearing aid impact that people are perceived as either maybe not as educated or not as capable because they're wearing a hearing aid. And that, I think, is what part of the over-the-counter solution is trying to overcome, is trying to reduce that stigma, and
Yep.
which will ultimately get patients to pursue some level of hearing support earlier on rather than waiting the typical 7 years, which then leads to a lot of complications because there's now cognitive decline, there's central auditory processing issues, which just makes it much more difficult to be successful with a hearing device.